Great. Welcome, everyone. We appreciate those that are able to join us this evening. We have a webinar. It is SGI's Collaborative Initiative for Client Management. So back some time ago, Jamie Risling, the Director of Corporate Rehabilitation Services for SGI, and I were having a discussion, and she explained that SGI is excited to embark on a new program partnering with Bridges and powered by ErgoWorks technology to collaborate with physiotherapists treating SGI clients. And there are a number of overarching goals of this program in terms of streamlined process and having workers improved outcomes. And Gary will be sharing more about that, but we're very excited to learn more about the program and to really encourage collaboration. So I'm excited to have two presenters to help us learn more about the new program. So with us, we have Gary Daranowski with Bridges. Gary has 18 years of experience working at SGI and 9 years in Auto General and 7 with a personal injury as a personal injury adjuster, as well as 2 years as a supervisor for personal injury. The SGI transition team, he was also involved with leading the SGI transition team lead of service provider subcommittee and medical committee from tort to no fault. And he served on the board of directors for the Saskatchewan Association for the Rehabilitation of the Brain Injured from 2001 to 2007. Gary served 2 terms as the national president of VRA Canada, which is a nonprofit association for vocational rehabilitation professionals. And he served on the board of directors of the Saskatoon Health Authority from 2015 to 2018. He is professional director certification program in 2016, a chartered insurance professional since 2000, and as well as a registered rehabilitation professional since 2005. Gary has been in the president and CEO role for Bridges Health Services from 1999 to current. He has 26 years experience in the healthcare sector, and he has been recognized by the Chamber of Commerce, being presented with many SABEX awards over the years. So we're very appreciative to have Gary share his information and more about the program. Also joining us this evening, we have Lisa LePage. Lisa is a physiotherapist who graduated from the School of Physiotherapy College of Medicine at the University of Saskatchewan in 2000. In her 23 years, she has worked primarily in multidisciplinary settings, performing multidisciplinary assessments, managing occupational rehabilitation programs at secondary and tertiary levels, managing long-term disability files, working in mental health programming, and has a special designation for pelvic floor therapy, having worked extensively in women's health. Lisa is a certified Matheson functional capacity evaluator and has her level 3 orthopedic manual and manipulative therapy certification. She has extensive training and experience in managing chronic pain conditions. She is certified in mental health first aid and has training in cognitive behavioral therapy for allied professionals. Lisa was born and raised in Saskatchewan and lives on an acreage south of Saskatoon. She joined Bridges Health in January of 2023 as a health service consultant, performing worksite assessments, return to work planning and case management, identifying barriers to recovery, and making recommendations to assist clients in returning to their pre-disability life and work activities. So welcome to our SPA webinar, Gary and Lisa. We really appreciate you taking the time to present today. So go ahead, Gary.
Thank you very much for having us today. Really appreciate the opportunity to share the information today in our program. in 2017, Bridges and myself became a founding partner in a technology company that produced what we're going to review today, the ErgoWorks program, that provides physical job demands analysis in a digital form. We also provide job matching and artificial intelligence with risk assessments and pre-employment assessments. So essentially what that means is we gather physical job demands from the employee, the employer. We have both of them review, sign off on them to ensure their accuracy and they agree with them. And then we submit them through a URL link that you have access to. So SGI could submit it, we could submit it, and or we could submit it, and you would have that as your goal and your physical job demands to go to. The key to this program is that it's all digitized. It has video in it. We can run artificial intelligence on it. But the nice part of it is, and you'll see this as we present this program to you, is that everything's in the same place. So years ago, we used to be able to do job demands analysis, and different therapists would put things in different places. Well, now we have everything in a uniform place for you to look at and find any time. So we moved off, and in addition to that, we moved from physical job demands analysis to entering information you can provide, information about physical abilities, through an FAE or an abilities form or a functional capacity evaluation. And we load that information in to the program, and it does the comparison of what a person can do safely and what they would be at risk of doing. So we've got data that helps us manage the return to work, manage the claim in a safe and efficient way. And so subsequently, we are able to load information in this program repeatedly. So as a person progresses in your clinic, the information that you obtain from them in your functional testing, we would like to see that come to us regularly. And every time we get it, we can rerun it and determine additional job demands that a person can and cannot do. So the very cool part of this is that this information is coming from you, it's coming from the SGI customer, the claimant, and the employer, and we've identified through a program what a person can do safely and what they would be at risk doing. So with that, Lisa, do you have anything that I missed on this that you can add? We're going to have a percentage job match Lisa will demonstrate, and the URL link is unique. So if you don't have the URL link and you have one of these cases that you're working on, please reach out to us so that we'd be able to provide it to you, and you'd be able to have that automatically. You'll see what Lisa will be able to show you. You'll see this evening the areas how she finds things and identifies things as she walks through one of these physical job demands analysis, and then we'll walk through a job match for you. Lisa?
Thanks, Gary. Hi, everyone. Thanks, Garnett, for having me. I'm going to screen share here. Can you guys see that?
Not just
Yeah.
yet.
How about there?
Yes, now we can see it. Thank you.
Awesome. Thanks. So this is what, when you click a link that you would either get from SGI in the PDA report, job match report, or if we send it to you, it would bring you to a page that looks like this. This is, I just did a sanitized profile to eliminate any personal information on this one. And this is what you would see minus this advanced edit and action. So this is the job media, and what we usually do is we take pictures and video. We try to do video on every single. Oh, my video did not load. Sorry, guys. Anyway, there's like less than 10 seconds of video, usually somebody performing a task, and then there's this job description, which is basically a summary of the client's position, their job responsibilities, and the work time with coffee breaks. We like to include any pertinent information in terms of description, just qualifying what their physical demands and how they might vary based on shifts or seasons, etc. And then what the next line is keep in mind, this is just the job profile. Okay, so it's we're going to go to the job match next, and then what you'll see is a list of physical demands with the highest level demands on the left, and in descending order going to the right. In this case, this person is a custodian at the athletic facility in Martensville, and they are pretty much on their feet the whole time. When we're developing this, when I interview the employer and the client and I attend the assessment, I usually try to break it up into the physical demands as well as the administrative demands, and then if there's driving. So we kind of break it up into those 3 categories. And then this is basically the summary of all of those. And it's important to know, I think most of us were trained to analyze physical demands in a job based on repetitions. And then that would fit the definition of the DOT classification system. This is a time-based program. So this is cumulative time spent in doing each of these tasks throughout the day on a typical day. We all know that there are days that vary in everyone's job, and so we try to capture the most typical day, and we can comment on the outlying situations that exist in that person's job. So there's all the different tasks. It's a little bit different than most of us are familiar with the JW that WCB uses. I think that's what we've all used the most. They include driving, foot action, and what was the other thing I was thinking of that is, data entry. Shoveling is a specific one, vibration, etc. So anyway, there we go. And feel free to ask questions as we go here. This is the essential functions and tasks. So this is where I was speaking of how we kind of categorize duties of jobs. So some people don't have any administrative or driving tasks, so it's strictly manual labor. And some people are the complete opposite, as you know. And then we try to do an estimate or a breakdown in terms of total time spent in each of those categories and assign the physical demands to each. So, administrative would be all sitting, data entry, what have you. Next up is the parts. So this is the different weight categories. And instead of measuring every single item or listing every single item that they touch in a day, we try to do it in terms of weight and offer comments about what those items are. Personal protective equipment is included, flooring is included. And then from here on in, this program is kind of nice in that it does break down the different environmental, sensory, cognitive type demands. That I always say that, for what we are doing at this time, we're dealing mostly with musculoskeletal injuries, but there are, as you know, people who have psychological components to their injury or concussions, brain injuries, etc. And so this next section is going to be a little more pertinent to people with those types of injuries. So it breaks it down into, as you can see, atmospheric conditions, cold, heat, wet, noise, and exposure to weather. Hazards, of course, can vary depending on the situation. Sometimes it's biologic, sometimes it's, moving objects in the environment. And if we feel that's a risk, we certainly might spend a little more time in that area and quantify and qualify that more. Sensory demands, this is related to our 5 senses. So again, it's based on occasional, frequent, or not present, or constant are our 4 choices. We don't get too much debate on those things. And then psychological demands, this is related or described with respect to risk. Okay, so what is the risk of their job security? So somebody who's a full-time permanent employee, not a lot of risk. So we would say low, right? But if it's a contractor, casual employee, or seasonal employee, then that would be medium to high. Autonomy. So how much independence and personal decision-making do they have? What is the risk there? Workload. How heavy is that job? What are the expectations, etc.? The pace of the work, and do they have social support? So this person in particular, very independent, but she's working alone a lot of her shift. So I assigned it a medium risk category, but certainly it's not like a time, nobody's monitoring her time spent on each task, right? So where we know, people who work in warehouses, they get monitored on how much time it takes to pick a order, and it's a very performance-based thing. So those are some of the things that we take into consideration. Aptitudes. Again, this is these are the predetermined categories based on color, dexterity, intelligence, coordination. So breaks it up into finger and manual dexterity, as well as numerical, form, and clerical perception, verbal or language. And again, because this was not a cognitive, or there wasn't a cognitive aspect to this person's disability, it's not quite as relevant as it might be for someone else. These categories, education level required, so it's a high school diploma or equivalent. This is usually information we gather from the employer, and based on the demands in these categories of what's the aptitude or performance requirements for their temperaments, of course. So then here we go. And again, this is really, so working alone, directing, it's really based on the psychological or cognitive demands of the person. So things that we're often looking at are they alone, away from others? Are they planning activities, which is a huge requirement, like managing people, influencing people in their opinions, judgments, making judgments, dealing with people. Short cycle work usually refers to more like assembly line type workers, performing effectively under stress, attaining precise set limit standards. So those are people where they work in regulated industries, working under instruction and performing a variety of duties. And again, if this was a real hinge point, I would certainly make more qualifying statements to describe these things. This is clearance requirements. So what do they need to be able to work with that employer? And in this case, it was a criminal background check, motor vehicle check, because she drives as part of her job, and a reference check. Now, this last piece becomes a little more pertinent, and it breaks down body by body part, the stress on each piece. So whole body vibration, exertions, etc. And there is a number of things to choose from in each category, but these were the ones that were pertinent to this person's line of work. Any questions about that before I go on to the return to work profile? Or any comments, Gary, that you feel you'd like to add?
So just to our audience here, feel free to post questions in the chat area of the webinar. You're welcome to post questions, and we can make comments, and we can discuss. Or if you would like, you can also raise your hand, and we can have you turn your video on, and you can speak as well. So feel free to make it interactive and post questions if you like.
The only thing, Lisa, that I would add is that we welcome the opportunity for any one of the therapists out there to contact us and walk through your patient on one of these assessments to help you become more and more familiar with them, and for you to understand the program and understand the depth of the program as it applies to the person you're working with, and that'll help you carry forward with other cases. And we're always here for you to discuss them and describe them.
Oh, we have a question here. Who is doing the job site visit and completing this form?
It's usually myself or one of our OTs. Right, Gary?
That's correct. We have physical therapists and we have occupational therapists do them. They're all secondary review by an occupational therapist. And that's just an extra added checkpoint that we have on all of these cases.
Thanks. That's all the questions at this time.
I think the one thing I probably would also add is that it's really important, and I think Gary alluded to it earlier, is before this ever gets shared with anyone, this is given and reviewed with the client in quite a bit of detail, as well as with the employer, to ensure that everyone agrees with the content in this profile. As we all, maybe those of us who've worked in secondary, tertiary programming, when the JW, I think, is the common practice is to have the JW, or at least the optimal practice is to have it completed and signed by both the employer and the worker. And I cannot tell you how many times in my career when I've gone over JWs with people and they're like, well, I don't agree with that, or that's not true, but they had actually signed that that piece of paper saying they did agree with it. And so then that becomes kind of a bit of a challenge so when we're out there and we're actually measuring, and as you all know, that's where a job site visit is very relevant, is to really get a good idea of what's going on in the day-to-day life of that worker. And because then we go over this individually with each of them, they're certainly under no pressure one way or another to not say or bite their tongue if they don't agree with it. So I think that's kind of a nice aspect to it. This is a living link as well. So let's say, somebody who hasn't been at work in a year, and then maybe they're on their return to working and they say, I forgot to mention this piece or what have you. You can certainly edit it, and it's a living link that can be referenced many more than once or often.
Yeah, the cool part, if I can add to that, is this is real time. So if there's something that needs to be added and changes any of the weights or job demands, once we enter it in the system, this URL link that had been previously provided to you has an update, is automatically updated.
Okay, so my apologies. I had mentioned to post comments in the chat, and I'm a little new to Zoom webinar, so I apologize for the confusion. It appears that the attendees can only post into the Q&A. So on the bottom of your screen, there's a ribbon of different options. So if you can post your comments or questions in the Q&A, that would be fantastic. All right, or you can feel free to raise your hand, and you're welcome to speak as well. So the next question here, are these job site visits being done on all SGI clients that are off work?
Gary, do you want to answer that? Yes, I can answer that, or if Jamie's in and she wants to chime in on this, she's welcome to take that answer on behalf of SGI.
So unfortunately, Jamie is ill today. She's texted me and she's not able to join due to illness. But we did receive some communication from Jamie, and that went out in an SPA email, so you can refer to it, but I can just refer to that here. This is coming from Jamie. The Bridges ErgoWorks referral will come in at 8 to 10 weeks from the date the claim is registered. SGI has indicated that the FAE could be done earlier, and they have a goal of collecting data for evaluation purposes. So even if the client goes back to work, the FAE being completed is not wasted due to the overall goals of the program. If the client is off work, then the FAE should be done by the PT even before the 8 to 10 week point. And SGI PIRs have been informed they and will be requesting them. So so from Jamie's communication here and what she's communicated is that if someone's off work, they do want to have those completed. And again, in addition to achieving the client goals, they also have program goals that they're wanting to do some research and track things. Is that consistent with your understanding, Gary?
Yes, that's correct. So if any of the therapists that are viewing this tonight have a case that they need an FAE on, and this is again stated that if the person is off 8 weeks or projected to be off work 8 weeks, then we want to do a PDA for them. It's what the agreement is. And then we would like to see an FAE of some form or functional abilities of some form on intake, but that'll be an SGI decision. And the sooner we get medical, the sooner we can do a job match, and we could work with the clinician, the physiotherapist on you know, what duties a person can safely return to and a return to work.
Great, thanks, Gary. All right, next question here. Who owns this data and what extra consent do we need?
So we, Bridges Health, get consents from the individual, and SGI have a blanket consent, and it's something for SGI to answer when a person applies for benefits, for the application for benefits. Inside of their application for benefits, they have consent to hire vocational rehabilitation and for us to obtain the information. Having said that, we don't necessarily rely on the SGI consent. We obtain our own, and we include the clinic that we know is attending, the person is attending, and the clinicians that the person has attended in our consent. So we want to make sure that we have that when we are submitting information to the clinic, or we have the Ask SGI to provide the information to the clinic. So we will work with you on that.
Great, thanks, Gary. Next question here. Is there an expectation that FAEs are done at the primary level? And yes, so this webinar is pertaining to primary physiotherapy services. So yes, it is the expectation that FAEs be done at the primary level if the patient is off work. And that is based on Jamie's communication, and we'll resend that communication out to the members as well as a link to the recording to this webinar. Is this specifically for primary care? So yes, this webinar in this program is specifically for primary SGI.
Having said that, if SGI had been providing us referrals for these at any level of care, if they've never been done previously, so the goal is to assist in safe return to work. We have the data to support that the program has the metrics for safe return to work and clear parameters for safe return to work. So we've done a pilot with SGI. We've done a pilot with other organizations that demonstrate that this program assists in an earlier return to work and a safe return to work.
Great, thanks, Gary. Does the info gathered through the FAE need to be submitted to SGI or Bridges?
I'd answer that as both. When you have the information, or you know we're involved, or you know that this is taking place, or you know the individual is going to be off work in excess of 8 weeks or has been over 8 weeks, you could contact the personal injury rep and request this physical job demands analysis be done so that we can complete it and do the job match with it at the same time.
Great, thanks. All right, are there enough people to do these job site visits in a timely manner at 8 to 10 weeks? Will they be put on hold if the file is under causation review through SGI?
Yeah, I think that's an SGI question in terms of causation review. All we can say is that if you contact the personal injury rep at SGI and you identify your patient, and SGI is aware of the program. This is a program that they know that they're utilizing on all cases of this nature. They can make that decision at that time.
Okay, and then just a resourcing. So what are your thoughts, Gary? Will there be enough resources to have the job site visits completed timely at the 8 to 10 week point?
Yeah, we have been ramping up, and to answer your question, we have been timely, and then there have been times when we've received an influx of referrals. I think it's like any of your organizations. You try to gauge the number of people you need based on the volume of work coming in, and so we are currently adding 2 people to our team for August, and we are ready and waiting, for any additional influx in claims and cases that are coming in. If you are waiting for any, please reach out to us or reach out to SGI, and we will prioritize them. But typically, we have them done within 5 days of the date we receive the referral.
I would just add too that if there is a delay, sometimes there's some other complicating factors, I guess, in that either because the ideal is that we get it all done within 5 days of the referral. If we're having trouble contacting the client or contacting the employer, or because that kind of happens a little more than we'd like, I would say, but we do strive to get them done within that 5-day time frame.
And we should work collaboratively with the physiotherapy community, and if we are having trouble gathering the information, I think it's great to ask your patient, have you heard, we're waiting for the physical job demands analysis and profile. Have you gotten back to Bridges Health on this so they can gather the information? So if we work together on this, hopefully we can close that gap.
Yeah, and in just my short time with Bridges, the physios have been very helpful in that regard, actually, because some people aren't as tech savvy. Sometimes they miss calls and they don't, whatever reasons. So yeah, the physio community has been really helpful in that regard.
Great. Okay. What is the process for small rural facilities that don't have resources or trained staff to do an FAE?
I would say that anything that you can give us in terms of functional abilities based on observation in clinic would be helpful as a starting point.
And then the other thing that I would add is that we do on-site worksite assessments and assess the person's function at their workplace or home or what have you. We get a number of rural referrals, and there is travel involved in the work we do. And we, in that case, I would suggest that we would go and make sure that those of us who are trained to do that testing would gather that information.
Yeah, the therapists that we have, all of the therapists we currently have, the occupational therapists and the physical therapists, all have the certification to do that. So if that is an area of concern for your clinic in a rural community, reach out to us and let us know, and we'll talk with SGI about having one of our therapists do some of that testing. We're not here to replace the clinics. We want to have the clinics provide this information. That's first and foremost, and so we want to work in collaboration.
Great, thank you. So there's a number of questions coming in about billing, and so So I'll maybe answer them all collectively. So again, this is, there was an email that went out along with this webinar invite. I'll make sure that that goes out again with the webinar recording. Jamie and I had a discussion about the billing, and it's really important to SGI that they don't detract from the number of visits available through the ePay program. And so the preference from SGI is that this bill be billed separately, and but it will be at the regular subsequent visit rates. So the ask was that you take the time that the FAAE required and then divide it by the number of 20-minute billing increments, and then you bill that 20-minute billing rate. So she gave the example, if it took 35 minutes, that would be rounded up to 2 billing increments, and then you would bill do a separate invoice to the PIR at SGI for 2 subsequent visits to complete that service.
The other thing is, when I get a chance to discuss this with the physiotherapist or whoever's going to be doing the testing, because I want to make sure they have the profile. I want to, because we're here, I want to work with them. I do ask them to I have been anyway, asking them to just confirm with the PIR how they would like to bill it. But yes, that is the common, or is that you bill it at the rate of the 20-minute follow-up visits, prorated for the time it took you to do the testing and the report.
Mm-hmm. And then Lisa, are you able to clarify? So there's another question here about the additional admin time required to complete the online form. Do you know, or is that something we should clarify with SGI?
The online, I'm not sure I understand what that is referring to. The online form.
Okay, well, maybe loop back to that. Yeah, so Geraldine, if you want to provide some additional context to that, we can loop back. All right, here's one for Gary. In the event of litigation, is Bridges responsible for these recommendations, or does it come back to the physiotherapist's license?
So when it comes to the return to work and the analytics that are provided by the program, we have determined that this is defensible. We've worked through this with SGI Legal Department, and we're prepared to defend the parameters here. We want to ensure it's safe, and so when we go through these, we want to ensure that we work through them with you. And so if there's a reason that you feel, a medical reason you feel something shouldn't occur, we want to review that with you, and we want to ensure that we're doing the right thing for the patient.
I would also add that when we're doing functional testing prior to allowing someone to return to the workplace, that is determining their safety or lack thereof for whatever type of work they do. And so if you're sending us a functional abilities evaluation that you have evaluated that patient and determined, and you've reported to us, for example, that they are safely able to lift floor to waist 20 pounds on an occasional basis, because you've done that testing and you've observed that and you're qualified to do that, that in and of itself protects you and is a safety guarantee. And I know, I'm sure all of you, as I have in my career, been, I have patients who come to me and they have a form they want completed for their functional abilities or what they're capable of doing at work. And we're expected to fill that out without having done at least we have been in the past expected to fill that out without having actually evaluated that person doing that task. And I think it was about a year ago or more, Garnett, and I don't know, you could speak to this, but I believe the SPA came out with a statement regarding functional testing and making return to work recommendations that we should not be doing it just simply based on an objective clinical exam, but we should actually be filling out that form or making those recommendations based on the fact that we have tested those people and we have determined their safety. So I think that's what's protective in litigious scenarios at this stage. And the data that we're using is data that you are providing to us. And this program simply creates a picture analysis to help either determine their safety or lack thereof to do that pre-injury job. And so I think that it gives credibility and reassurance in either direction, really, to all the care providers, the employer, the client. But it is based on that objective evaluation the physiotherapist is providing us, or the OT, or whoever is providing the functional data.
Thank you for that, Lisa. That's very important that you raise that, because clearly this is not our information; it's your information, and it's the client, it's the client's information, your patient's information. And so subsequently, the program creates the mathematical equation based on the data that's put in there from the individual, and repetition and weights and measures and distance and push and pull. So really the program, as we're saying, what we're trying to describe is it's trying to provide some confidence in terms of, based on the job demands versus the information you provide, in a mathematical equation of what is safe for them to do and what isn't safe for them to do.
Right. Very helpful. So there's some more clarification here. So in terms of the online form, it is, I am assuming the FAE info will be entered online to the URL link, and just clarifying that this would be billed by the 20-minute subsequent visit code rate, basically. So Lisa, just to clarify then, the physiotherapist would be expected to input some FAE information via the URL link?
No, so that gets submitted over the portal, usually, that report, like functional testing report. And I think I saw another question is, how are we reporting it? And right now we don't have a standardized format for that SGI has generated for a functional abilities evaluation. We have, Bridges has a form that we use that we are happy to share with you if you don't have one. Some people are using the secondary template reporting form. I think, Gary, if I'm not mistaken, this will become a more standardized thing, and I'm guessing there will be a form that will get filled out that is as proprietary to SGI. But we're happy to assist you in that right now, and if you don't have a form to report on.
Yeah, Gernette, has SGI discussed this part with you? Has Jamie discussed this with you?
No, this hasn't, but I will definitely take it as a takeaway from tonight, just to get some clarification on that.
Yes, so I believe that's correct, that they are working on something or have something that they're prepared to provide. But having said that, overall, we're happy to utilize the information that you already have. If you have a form, utilize what you have and submit it. You can fax it to us, but there isn't a method for you to actually input the information on this form, and that's a good idea. We might take a look at something like that down the road in an update, or when we're looking at making changes to the program. That might be something useful to think about, to have the clinicians put the information in there from their FAE. Thank you for that.
All right. So next question. Who monitors the return to work program?
So as we're inputting the information in, we come up with a job match. We utilize that to have a discussion with the employer. So we are managing the return to work program, and continue to gather information from the therapist and updated FAEs or updated functional abilities. And we can input that information every time that you feel it's appropriate to retest the individual and gather it as they progress through your clinic, and you retest them and their abilities improve. We want to ensure that we have that information so that we're continuing to add to it and we're able to escalate the return to work.
I think I would add too, I think if I understand the question also, you're asking like who's once the person is on return to work, who's monitoring it, and it's a joint effort. We will design the return to work in collaboration with you, with your recommendations, and so we might take care of that logistical paper admin side of things and liaise between yourself, the employee, the employer, and whoever else needs to be included. But we never design it or want to supersede or override. Like, we always want to do it with you, and we're kind of the administrator, if you will, like to help ease the paperwork caseload and stuff like that. I hope that answers the question.
Yes, thank you. So next question. So do all current claims that are over 10 weeks need to be referred for this? And yes, so Jamie has indicated that she, just 1 second here, sneeze. Jamie has indicated that she's communicated to the PIRs to be requesting these. So they're well aware, and that is the plan, that claims when people are off work over 10 weeks, that is the plan to refer them for this.
But it's the job of the PIR that it's their job to refer them. The physios don't need to.
Having said that, if the physiotherapist has one of those cases that's over 10 weeks, and you know that the person is continuing and they're going to go to secondary or whatever the case may be, it would be worth a phone call to the PIR and making the request so that you have the information and we have the measurements and we have that going forward, and that the secondary team and yourself have, or the tertiary team, whatever it is, have the information they need to do to work towards their goals that are outlined in the PDA.
Okay, so then ultimately, in the end of the process, who is responsible for drawing up the complete return to work with progressions and duties? Is that the physiotherapist or Bridges?
So as Lisa has correctly identified, it's in conjunction together, and that we would be in contact with the employer and the patient on a regular basis. And as things improve and we run the job match, and the job match identifies additional tasks or duties the person can do, we would modify the return to work plan as that is appropriate. Now, we want to, I mean, if we can design a return to work plan as you have in the past, we have a starting point where they could do 50% of their job match. And we haven't even gotten to the job match yet, where Lisa can show you how that works. We want to be able to have that in place. And if you have an agreement with Lisa or one of our other therapists that look at, we've got a starting point here with an FAE, they can do 50% of their duties. We have identified the things they can't do, and the way the individual is progressing, we expect this person to be able to return to all their duties over 6 weeks. We should do a 6-week plan and have them return full time, and we can continue to run at whatever appropriate time you think that FAE should be repeated, and continue to run the program to escalate the responsibilities and duties in conjunction with that. Now, something I think is important because of the question that came up about entering information in here on the FAE. We want your information from whatever form you have, but the PDA is the only way you see it through a URL link. You do not see the job match through URL link. We have to send that to you by fax. And currently that's done because of privacy. As soon as we start entering medical information on the case, right now, as you see these PDAs, you see a job and you typically wouldn't see the person's name on it. You see the person's occupation, and we identify the employer, as you see the City of Martensville on this one. But once we have that job match, we would send that job match to you through fax.
Right.
Garnett, I just noticed there's a couple of other things that I think we may have passed over in the Q&A.
Yes, yeah, there's quite a few here. I'm trying to put them by topic here.
Oh, I see. Okay, never mind.
Yeah, so who is monitoring for objective signs of harm?
So when we design the return to work, we want them still attached to the clinician or the facility they're attending. And we in collaboration with the clinician, identify appropriate times for them to follow up and monitor the objective findings. Those of us who are qualified, like I have gone and done some on-site job coaching. And I have performed objective evaluation if needed on the work site to ensure the person's safety. But usually what we do is we structure regular follow-up with their clinician during the return to work. Or if it's going sideways, as is common practice, they're always advised to contact their treating provider right away.
Yeah, what we're doing isn't to replace what the treatment provider is doing. We want to work together. We're here trying to provide objective data to give confidence to the employer, the employee, and you, the clinician, of identifying job tasks the person can safely do. So what you do now and monitoring and seeing your patient, none of this should change. This is just a tool in your toolbox to help. And the only area that we're participating in at a greater level is coordinating the return to work with the employer, but we're not here to replace anything that you're doing. So we want to work in conjunction with you.
So next question here. Is Bridges doing the physical return to work report to the employer or to the PT?
It's a joint document, just like any other return to work. It's designed in collaboration with the treating clinician, and it is sent out. It's the way I do it is we have that discussion. We outline what the parameters and progression of the return to work are. I put it in a formal document. I send it out to all parties for their review and signature. But before I even send it out for signing, it is reviewed with the patient, and the clinician who's treating the person.
Great, thank you. Is this an expectation of all primary caregivers, Chiro and MD?
Like in the function, I wonder if that means is the functional testing. The functional testing is an expectation of anyone who is trained to provide that type of evaluation. I'm not familiar with many chiropractors who can do that type of testing, but
is your consent for return to work information only?
Our consent is for pertinent information related to their accident injuries, to obtain and release information that is relevant to their accident-related injuries or history.
Thank you. So physical therapists do the FAE, and going forward, Bridges and Ergo Works are responsible for all return to work planning. So this is a clarification. I think we've covered that it's really done in collaboration. Any other comments on that, Lisa?
No, I think that you hit it spot on. It really is. Physios, I don't know about you, but we struggle with, the paperwork thing is difficult, right? And I think there is another question about billing for your time regarding follow-up at a primary level. That is an issue. It has been identified and discussed. And that's another thing I advise physios to do, is to send that PIR an email and say, how can I bill for my time for conferencing with Lisa? Or, because there's not an expectation that you would do this work for free. But it is right now, until there's more standardized billing or code, what have you, it's just reach out to the PIR. They're very receptive to that, and they will advise you accordingly.
Yeah, I think that's helpful. So it was very clear from Jamie that the FAE time is to be billed separate, paper billed separate from the ePay system, so it doesn't impact the number of visits. But I will seek clarification on some of the other areas in terms of reviewing the job profile and the communication collaboration time with Bridges, and all of the sort of supplemental things. So I will seek clarification with Jamie on that piece of it. And I'll send a communication out to the membership. So next question here, does this format then decrease or eliminate the need for secondary clinics due to this level of early functional assessment?
I don't see that at all. Again, this is really a type of assistance and collaboration to help guide early return to function, because we all know that's what's best for patients, even in a transitional capacity, modified capacity, what have you. So certainly not. The whole idea behind this is to hasten return to function or eliminate and curtail time loss, because we know what happens when that gets extended and they get untimely care or all of it. It's not good for the patient, right? So this is a early intervention to facilitate it and decrease the risk for chronicity.
Thank you. So the PT does not communicate, so this is a clarification. So the PT does not communicate with the employer anymore. The PT just communicates with Bridges.
Yeah, ideally, we act as a liaison so that, and the point person for communicating with the employer and contacting them, spending time educating them, or whatever needs to be done. And because we're making early contact or whatever, we're going to do the worksite assessment. We're meeting with them anyway. We're just, it's probably better for everyone if we act as a point person when we're involved in the file.
Yeah, discussion on job accommodation and return to work takes place at the time the assessment is done with the employer.
Yeah, good point.
The PDA, yeah.
Right. Okay. So there's some additional comments and a question here. So finding that right balance. So there is a collaboration goal, but there's also a need for accountability. Also concerned that making sure that patients aren't seeking different answers until they find something they like. So in terms of that accountability, who makes the final decisions? Is Bridges recommending to the physio, or is the physio providing data for Bridges?
Yeah, there are times where we certainly, in my tenure here, that I problem solve with physios or the treating providers about what might be best. Like, we certainly aren't telling people what they need to do. They're the ones who are seeing and evaluating the client. Again, this is really a partnership, a team approach. So we're using your information that you've obtained through evaluation to put into this, for example, in the return to work profile or the job match analysis.
I think it's important to say that we're not changing anything you do with your patient.
Mm.
You're the therapist, and nothing in that area changes. The only thing that changes is that we do these assessments, and we meet the employer, and we set the stage, and we talk about labor standards, and we talk about human rights of the patient if we need to. We just prepare the employer for graduated return to work. And other than that, everything else that you do with your patient is what you should not change anything.
I guess the only thing that would be different for SGI clients, and I think we all do it with our WCB clients, is we do some earlier on functional testing with these clients than what we have done historically in the past. Or at least we're hoping that's going to start to happen more frequently.
All right. So if the treating practitioner does not have access to the job document secondary to privacy concerns, or the employer, how can the practitioner set up goals and plan for the return to work? It would seem Bridges would be the decision maker in the medical file regarding the return to work, and the physio is the data collector. Is this correct?
I'm not sure where the privacy concerns come from, but you go ahead, Gary.
No, I mean, again, I just repeat that we're not changing anything that you as a clinician does. And there is the reason that we're able to send this out in a URL link is that there's nothing in it that affects privacy of an individual. The individual shouldn't be named on the document. It should be the occupation and the employer, and that doesn't create a privacy issue. What creates a privacy issue is when we start entering medical information, and that is why we don't include it in a URL link. We send that out in a fax identified for you, and that's a completely separate area which we haven't really gotten to yet. We have to show you the job match yet.
Great. Okay. Well, thank you very much. Very engaging questions. It shows that there is a lot of interest, and it definitely will take some time to work out an ideal process to meet the goals of SGI. I want to thank everybody for attending this evening. I will take the takeaways, the follow-up with SGI. I will take those and work with Jamie for responses. This will potentially become agenda for upcoming third-party payers committee as well. We'll check in to see if there's any additional things that need to be worked through. And we really, really appreciate Gary and Lisa for taking the time this evening. Very, very helpful to learn more. And I really appreciate the demo. Fantastic technology. And we look forward to seeing this successfully implemented.
Thank you for this opportunity, and thank you for your time.
Great. Thanks, everyone.
Thank
Have a good
you.
evening.
Thanks, Garnett. Thanks, everyone.
Bye.